No, 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 no. Rich has joined via Zoom.
Allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Just note that we're following the city guidance regarding masking. So in the conference room, if you are vaccinated, you're not required to wear a mask, but if you are unvaccinated, you're asked to do so. And the rest of the facility, everyone is wearing a mask.
Correct. The healthcare facility, so this is more business, it's under mask mandate, always.
All right, so with that said, I'll open up for public comment. Anyone have any comments to make? Is there anyone on Zoom, TV, Mike?
No public guests. We do have hospital guests, but no one has their hand raised.
TK, I can hear you very well, but I can't hear Jerry.
Can you hear me better now, Rich? I put the microphone right on.
It's all muffled.
How's that? Can you hear me now?
It's a little better, but is the microphone right by TK? Is that,
It's right in front of Jerry.
Yes, it's literally that.
okay, because you're perfect, TK, but I don't know if others on Zoom are having the same issue.
This is Casey. I can't hear you either.
Can you hear me now?
Can hear you, but I could hear TK perfectly, but you're slightly muffled, but go ahead.
All right, so next item of business is approval of board meeting minutes for May 27th, 2021, regular board meeting. Are there any comments before we make a motion for approval? All right, I will accept the motion. Thank you, Kristen. And second? Rich?
Aye.
Aye. And I vote aye. Okay, now our board meeting minutes for our special meeting, June 14th. Any comments on those minutes? All right, I will take a motion to approve the board meeting minutes for June 14th. Kristen motion, thank you. Rich?
Aye.
Second, and aye, okay. And Kristen, how do you vote? Aye. And I'll vote aye. All right, item number 6, medical staff report. Dr. Cooper, do you have anything to add?
I'd like to bring up that Dr. Mellon, our PR director, resigned this last month. And, we basically had 100% endorsement of him by the doctors. It was sad to see him go.
So with that, are we ready to do the reappointment?
I didn't get.
Okay, I'm sorry. I'll read them off. So
Okay.
it looks like we're doing reappointment for Sergey Skurkovich. Sorry if I pronounced that wrong. MD radiologist and David Milico, MD radiologist.
Yes.
I will accept a motion to approve those. Thank you, Kristen. Rich? You second? Second, aye. And I vote aye, and I'll vote aye. Thank you, Dr. Cooper. All right, so next item, number 7, policies and procedures. We have 3 to approve admit 021.001, determining primary care, admit 022.001, and patient registration, and admit 023.002, notice of price and practices. Does anyone have any questions or comments on those before we make a motion to approve? Did you have anything on these, Rich?
No, no comment.
Then I'll accept the motion to approve. I make a motion. Thank you, Kristen. Second, Rich?
You need, aye.
And Kristen, I vote aye. Thank you. All right, and then we have one policy to rescind. Admit 016.001 and the upright collections. Now, do we have anyone on who can, I just wanted to make a comment whether these items was included in a different policy, and that's why we're rescinding this one. Does anyone on the phone know?
Hi, this is Charlene. I'm on the line.
Thank you, Charlene. So I just was wondering, the items that are covered by this policy, did we move those into a different policy?
Currently, it's an application issue, and so the staff are not performing upfront collections at the hospital. But once we have that application up and running, we will bring this policy back. We are working on another policy to address if a patient pays out of all of it out of pocket and not wanting it to go to insurance. So we do have that policy we're creating it right now.
Okay, great, thank you. All right, I will accept a motion to rescind policy admit 016.001. All motion. Thank you, Kristen. And second, Rich?
Aye.
Kristen, how do you vote? Aye. And I'll vote aye. All right, so that moves us on to item number 8, the May 2021 financial report. Steve? You don't mind?
I don't like the numbers, but I don't mind. We're on tab B. So for the month of May, you recall that we talked about the budget for next year when we talked about the projection of the current fiscal year, which May is the 11th month of our current fiscal year. We are projecting significant losses for the year. And May had the characteristics of those losses that are revenue to historical was down significantly. It was very near what we created for budget for the year, but the budget was based upon assuming that our volumes would be down and also projected a significant loss. But it's indicative of why we're experiencing a huge operating loss and the things that we need to change, basically the utilization of the hospital, utilization of the lay-down clinic, to get to both our budget for next year that we're proposing and back to where we need to be financially stable and support the strategic plans we have for a new facility. So for the month of May, we had a net loss of $143,000. A net loss of $143,000 compared to a budgeted loss of $182,000. Again, this reflects a positive variance of budget, but the budget was based upon adjusting our utilization and our volumes for COVID and other issues we're dealing with. And they generate, you can see, a significant loss for the month. It was positive primarily due to that we had a positive variance in operating expenses. We did get 2 small COVID grants. We had $20,000 from Lewis County and $6,000 for our infection control staff doing some training through New Mexico Rural Health. And then there was small negative variance in gross patient revenue. So we just go down through the components of it, and they just support that our utilization is very low. Our inpatient census, both swing and med surg acute, was 1.06. The nursing home census started to come up. It was at 12.9, and currently it is at 14. And we're looking at doing additional placements to fill the remaining 2 beds. We had budgeted 15 both in this year and then for a proposed budget for next fiscal year. Lake Almar Clinic, again, our clinic visits were 675, which is a budget of 922. Expenses, there wasn't a lot going on there. Negative variance of 39,000. And then there's the components of the change. Our cash decreased from 135.8 days cash on hand to 127.1. As stated here, is due to the loss for the month of May, and then we had 2 intergovernmental transfers, one for AB 113 repay, and then a prime grant of 269,000. We also had 2 intergovernmental transfers from April. One, we saw the payment come in of just under $78,000, and then the prime grant payment did come in June. I'm sorry. We received $613,854 for this the intergovernmental transfer we did in May. Also in June, we received one of our rate range payments, the Medi-Cal rate range from California Health and Wellness, just over $2 million. And checks in the mail from Anthem, as they say, for the second rate range payment of just over $1 million, $1,054,000. The combination of the prime grant and the 2 rate range payments reflect approximately 80 days cash on hand. So we're looking at ending the fiscal year with about 200 days of cash on hand, which is great. Still, our operations are a challenge. Let's see. That's all I have for me. Any questions or comments or?
I think my questions were answered during the treasurer's meeting.
Okay.
Thank you. Kristen, do you have any questions? Rich, do you have any questions?
Jerry, one moment, he was on mute.
No, sorry, no.
Okay, thank you, Rich. Thank you, Steve. All right, so I guess we can move on. Actually, no, I need to wait and accept a motion to accept the May 2021 financial report. Kristen, Rich.
Aye.
And I vote aye. All right, moving on to the fiscal year 2021-2022 budget approval. We did go through this in some length during our special meeting on June 14th. Does anyone have any other questions or comments regarding the budget? No? That being said, I will accept the motion to approve the budget for 21-22. Thank you, Kristen. And Rich, you second and vote.
Aye.
Thank you, Kristen. Aye. And I'll vote aye. All right, the next item on our agenda is the board meeting status, to continue discussing whether or not we want to do a combination, continue with a combination of Zoom, or if we want to go back to just in person. And I'd like to hear what the other board members think and what our thinks. Either way is fine with me. Accommodation, does that work?
Yeah, it's my take that, the guidelines that came out on the 15th, that it's opened up a little bit, but I think that we need to offer both options to the community. Some people are safe, and let's be clear, in this room, we can be maskless if you're vaccinated, masked if you are. The clinic, the offices, the hospital is under the New California mandate of mandatory masking. So the public should know that, our staff know that. This is sort of sequestered as a business unit, so we are allowing it here. So I would say let's continue with the hybrid just to provide full access.
I would agree.
Um,
Yes, Rich?
I think that's a great idea, but we need to improve the audio because it's very difficult to hear you clearly.
Thank you, duly noted. All right, so moving on, I don't think that requires a vote, do you, Sean?
I think it's just information.
Okay. All right, well, our next item on the agenda, number 11, HRG. Steve, do you mind walking through that one with us?
We've also discussed this one in some length at the treasurer's meeting, but in short, may show some improvement. The total AR days went from 64.7 to 62.6. We have seen substantial patient account collections in the month of June, in addition to the other money I spoke of. So our anticipation is that that we're going to see continued growth or some continued positive movement in the AR days. The only thing that's going to trip us up is it appears that the Medi-Cal is holding their payments. They typically, at the end of the state fiscal year, they'll hold the payments until the new state year starts. It's unfortunate because part of what's been in our outstanding accounts receivable has been the placement of new residents. When we get a new resident, it takes some time to get them converted to from their Medi-Cal coverage into Medi-Cal long-term care. And then once we get that converted, then we bill multiple months in arrears or retroactively. And so right now we have substantial funds sitting out there. We're starting to see some of the money come in. We're getting their approvals, but I don't know that we'll get them all settled by the end of June. I'm certain we'll see it into July. But instead with what we've seen on the other side, I think even with that, the days are going to come down. When we get current on all of our residents, then our days will come down further in July. So looking forward to seeing the numbers review.
As are we.
Yeah, right.
Any other questions or comments? So then we can move on to item number 12, our strategic planning committee update. Sean?
Sure, I want to give an update on the new critical access facility. We continue our land due diligence. So this is a multifaceted, multi-swim lane process. I can tell you, I can report that the legal review for the title report is completed. The land survey has been completed, geotech has been completed, phase 1 environmental has been completed and submitted. None of these show anything that is to be concerned about on the geotech. There was some discussion around some tanks that's being mitigated right now. The old buried tanks. The NAPCO process and the Chester Coast Utilities District annexation is in discussion and in progress. And we will be conducting a floodplain protected species survey that is going to be required by county anyway as we start to do our entitlement. So we are tracking to all of our due diligence. We are expecting, we had a little bit of a push on the escrow codes, but it looks like we're marching in the direction we should be. This will put us in a position as we work through the general plan amendment, which is what we have. We're in the county to work through that. Every one of these things moves into the general plan amendment zoning. So we are making progress. It is unfortunate, we mentioned it before, that we have to do a general plan amendment, but everything that we're doing serves two purposes: in preparation for the general plan amendment and zoning, but also for our USDA funding. We require a lot of these things to be done. So we're really completing both of them as a kind of two swim lane option.
And we expect to be closed by our next week.
Yes, and we'll report the closure of the escrow. The budget is still being in review. We had an initial budget of sort of just throwing it up there, taking a look at every possible option, and it's quite large. We're now in the meetings are in the process of running it down and starting to define it a little bit better. So we'll have a better understanding of the quick access project budget, hopefully by work week. Okay. Public awareness and promotion. So we have our Aspen street architects. They are putting together our mock-ups. This is to be shared. This is actually going to be kind of a visual reference point to what our new facility is going to look like. There won't be a lot of specificity as it relates to each individual department and rooms, what they look like, but it will have sort of the layout, the facade, the layout, what it's going to look like. And that's really important as we move into public awareness and promotion. I want the public to be constantly aware of, well, get an idea of what it looks like, but also be aware and be able to ask questions about our new quick access hospital build. This is also going to be part of our foundational discussions in the foundation. So we now have a 501c3 protected charitable giving capability under the Lake Alamo Foundation. We are a vertical into that foundation that people can contribute in a tax-free method towards the critical access hospital, which is good because of funding sources, while we're working on them, philanthropy is going to be an important part of this. I did speak at the town hall about the requirement for the critical access hospital build. So the community is starting to get awareness that this isn't a want to build, this is a have to build. For those what's on the record here, Senate Bill 1953, which is the seismic retrofit requirement for the state of California, says in 2030, if we haven't seismically retrofitted our old building, which is not capable of being retrofitted, or we are not a seismically approved building, we shut down. It's basically a facility, we have no hospital. So we are jumping way ahead of this, 10 years ahead of this, because there is a compression zone in 2025, the last 5 years of this. The expectation is that prices and the availability of labor to build hospitals is going to diminish in labor and go up in price. And that's that compression zone as other critical access hospitals are working toward this. And I just want to, get on the record to know that we're not going to wait for that. So we're going to press ahead on this. And public awareness is really important. Okay. The existing facilities up there, while we are progressing with the critical access hospital build, we're doing a lot of work on our facility to get us through the next 5 years. So the re-roofing project starts just after the 4th of July. They have received the materials and they're staging them. So they're preparing them for the new roof build, the new roofing project on the hospital. Campus painting project looks like it's in a bit of a lull. They're going to come back also after the 4th. We have done some painting, some base painting. It's in production phase. And Lynn McCurdy has been really paying attention to this to make sure that we're getting what we paid for. The flooring project is TBD still. We're still waiting on the flooring contractors to be able to get their materials before we start scheduling. Our security camera project was waiting on the completion of our IT network assessment, which was delivered to yesterday. And we'll be discussing that in more detail. This requires a server component that we want to make sure that our server farm and our IT infrastructure absorbs. So it's waiting. The parking lot driveway repair is 90% complete. We still have some things. We think it's some road base. Is that right, Steve? That we want some road base so that we can do our own patching for certain areas where our maintenance folks can do that. Campus cleanup, the train car is still on the campus. It's still here, but we're working to find a new pay and there has been some movement there as it relates to the contract that we hired. The flagpole, the install date is to be determined. It is here. And the campus perimeter fence, if you noticed, is starting. We've begun tearing down the old fence and putting up. So that's the latest on our campus projects.
And I did want to comment too about the home facility, painting and roofing and all that, we're calling it upgrade, but it's really also for maintenance and stuff that really is the need. So these communities wondering we're not spending money on these things just because they have to be done.
We definitely, especially the work loss issues. Okay.
Any questions or comments for John? All right, hearing none, then let's move on to item 14, departmental issues and reports. Yes. Oh, I'm sorry, yes.
Okay.
John.
Just
The
no problem.
CEO report.
Sure. So our physician recruitment continues. We have a little bit of a lull here where we got pretty lucky when we first started this, where there were a couple of 2021 graduates that were available. We were late in the game, but we did get the one that we were working toward, and it didn't work out. I do have more resumes coming in from our recruiter, but they're 2022 grads, so it's a little bit down the path. I was approached by a recruiting company that we used in the past, Jackson, and apparently we have a bit of a credit with them. I am looking into their pricing structure. It's considerably different from Medicus, who we are using. But we may want to use that credit and go with Jackson and see if they can do something else for us. You know, they say they have a bigger database, but everybody in this industry has a bigger database than the other person. So I'm evaluating it now. It's a different pricing structure, but I think that we need to tackle it in two different directions and start really working toward that. Announcement in position changes. Dr. Cooper was capable of sharing that we have one of our emergency room physicians that has resigned. Dr. Mark Nielsen is going through credentialing at this point and is expected to be on the August schedule. That's locally. He's been doing emergency room work for over 6 years, and he is committed to our growth, viability, reliability of Seneca Healthcare. So we do have a local position that will be filling that spot. Information technology, man, is there a lot going on there. So I can tell you that Apex Technology, we hired to do our assessment, do the assessment. And let me say it wasn't a shock what they came up with. It was pretty interesting what they found. Certainly leads to a lot of discussion around why we have fallout, why things aren't connecting, why we have systems that don't pick up, why we have latency. If you can, you can say that I thought it was a very comprehensive report. TK was there with me, very comprehensive report that pointed out a lot of real problems, some of them security. So I have quite, they got my attention on this. And I'll be sharing more with later, but how much was done. It didn't show anything that I wasn't too shocked about, but we do have a remediation plan that's moving forward. Our IT managed services currently, managed services are the companies that are supposed to take care of remotely or on site, our servers, our switches, our infrastructure. That is currently with CSI. My name is CSI. I want you to know that I issued a termination letter to CSI. The services that we are getting from them are ambiguous. They're difficult to follow, the nickel and diming, and it turns out from the assessment that a lot of the things that they should be doing, patching and such, aren't getting done. I issued the letter. It has been escalated within their organization. So I'll be able to report back to the board whether or not that's going to be the case. We do have another vendor in line to take over our managed services that we have been in. So it's not like we're going to lose the managed services. We would be willing to move right over. The electronic health record evaluation being Cerner, we are going through a lot of iterations right now. So there's been a lot of discussion about Cerner, making sure that the modules that we're looking at complement our operations and they're going to complete it. In other words, we're not leaving anything off the table that we need as an operation, including a lot of the revenue cycle pieces, our physicians' ability to work more remotely, our physician and our patients' ability to do electronic signature and everything. So we've been vetting that. It is in the final stages of review. The master services agreement and terms and conditions have moved to legal. They are in legal's hands right now. We're expecting results on Tuesday with markup. It is the sales order has been vetted by a lot of folks in the organization to make sure that it's complete. I have pulled some class reports. I've spoken to a few people that have Cerner Community Works, but I can tell you that we want to move forward with that. There'll be more dialogue as it relates to cost. Steve has done a total cost of ownership of our current system and what's going to cost us for Cerner. I think that it's not a bridge too far. So we'll be talking about that.
We talked about this before, and we talked about a couple of things. I think that was a concern. Steve, are you feeling more comfortable with the revenue side piece of the new system?
We're still trying to get our answers. They're working with us. We just haven't.
That's fine. I just was curious about where that was. And then the other piece was as
So that's next. I said our wide area network, there's been our wide area network is basically how we connect out to the world. It's all the connectivity outside of our campus. So when we connect to our internet services providers, what sort of bandwidth can we get? We all know that's a challenge we're facing. What can we get, and can we pull redundant? So instead of just having one line out to the world, we really, as an organization, need two. If it goes down, we always have to have it up, especially if we move to a hosted solution, a hosted electronic health record, which for instance Cerner is, it's hosted in Kansas City. We don't want somebody to click the line and we're done. We have to have redundancy. As it turns out, we talked to our Cerner folks, and all they need is 10 megabits to run full duplex or complete without latency. They're asking for a dedicated 10 megabits. We are currently, according to TK, her research, we have 100 meg long dedicated circuit into the organization, which isn't a lot. I mean, in comparison to what's available, but she was also talking to our partners and internet services provider, and we're going to get about 25% of that bandwidth. So we've got considerable bandwidth on top of that. Rule of thumb in healthcare is always leave a 30% margin. You want that high water mark to never get above about that 30% left over. Our highest water mark in total use was, I think TK was 75 megabits.
It was more like 66, but rounding it out. In the last 2 months, we hit that peak twice, and we were there for less than 5 minutes.
So our current bandwidth, we should be substantial enough to handle our business traffic. And if we move to a software as a service, the traffic with the Cerner application. So I don't know that we're going to be chasing a higher bandwidth at this point. What we will be chasing, though, is a redundant provider or a redundant line. So we're working on that. TK's in the middle of the throes of that right now. So let's continue. All right. Operations. We're focusing, Steve mentioned it in the budget, but we're going to be really focusing on services and volume. The only way, that we are going to, the old adage that you can't cost cut your way into profitability is true. We have to grow as an organization. Our clinic volume is really down. It's just not good. And that needs to change both in specialty services, but also in primary care, primary practice services. So our focus in 2021, 22 is going to be the volumes and being able to accommodate the volumes. I think some of that's actually going to be our electronic health record. There's latency, there's issues with it. And I think it does, if you will, hamstring some of our providers. That's not going to come though. Best case scenario, if we sign the contract today, we're looking at July of 2022 before we can have a go live with Cerner. It's a 9-month implementation. Okay, so that's really going to be our focus in 21, 22. Our chief nursing officer, an announcement went out some time ago, is retiring. Erin is going to go back to Mississippi and bounce grandbabies on her knee or whatever. In the heat, we do have a search that's out for our chief nursing officer. The job has been posted. It's posted on our social media. We're also doing several job boards elsewhere. It's also in Indeed. We have had several into that. We also have our nursing house supervisor position is open. This is a pivotal position. Casey Broussard stepped into more of a quality / swing bed development role, which is good, very, very detail oriented. So we are looking for a house supervisor, pivotal position, tough position. It's in the weeds every day. So that's also posted. Medical imaging manager, David Gary, has notified Seneca that he wants to move out of the management position, wants to stay aboard, but the management position just would like to move out of it. So we are currently looking for an imaging manager to take over that service line. The sleep center evaluation that we had about a month ago is not dead. We still want to go back to that, but there's so many things going on that are higher priority. There is no update right now about developing sleep center evaluation center. The MRI mobile service that we did speak with them. They're going to be doing helping us with some of our marketing out there to just kind of dispel the idea behind MRI trailers on MRI elsewhere. But also I've asked them for some enhancements. The enhancements is going to be music for our patients while they're in the MRI. You can wear the earbuds and have music. It just helps get your mind off what's happening and some of the claustrophobic concepts of MRI. So those are the things that from an operations perspective that are higher level. Marketing and public relations, the Chester Town Hall that we had on the 14th, I thought went pretty well. I tried to share all of our projects, Botox, welcome that, such with the community, but I also really moved into why the critical access hospital. I really want the public to understand why it is that we need to build a hospital. It's not just I wish I could, like I mentioned earlier, it's a have to, or lose it forever. I think that the public is going to be aware that there will be more and more of that going on. So there's awareness. Our health fair, we had 13, Karen, was that right?
13 yesterday,
17
17 today.
17 today.
Yeah.
So, that's about average. We keep about 15, so that's good. Good showing, and we have another one coming up. So the healthcare was good. The farmers market was a huge success, and Seneca was there. I was approached in the booth and asked a lot of questions, answered a lot of questions, met a lot of the public. We plan on doing that on a regular basis. So Seneca will be representing the farmers market. If you didn't go, just for the public to know, it was really a very good step-off point for our farmers market. A lot of people, and there's more vendors that are jumping in. So I'm pretty excited about that. It's a good time to just mingle and communicate. That's it.
What's going on? Any questions for Sean?
I'm sorry. Yeah, so I'm going to bring to the board. So the Lassen Lake Elmer Basin Regional Trail System concept. Well, this is, for those that aren't paying attention, this is a trail system that's literally going to go all around the lake. There's been a lot of property owners that are donating. Collins has donated a great deal of this. On the North Shore, this is a trail that is going to be walk, run, ride trail that is going to be going all the way around the lake. Caltrans is jumping in on the West Shore, so this is really getting some traction. I was approached. They're going for a very large grant to add to the funding source for this, and I was approached by the members of the Lake Elsinore recreational folks for a grant. There's a big component in the grant partners. When you put a grant partner in, especially a healthcare environment, that this is an outdoor activity. This leads to overall mental, physical health. I think it's important that Seneca is a sponsor of this. I'm just putting it in front of the board to let you know that I would like that Seneca is mentioned in the grant proposal as the healthcare provider. In addition to that, we may be looking, and I'll bring more information. We may want to sponsor the first 7 miles. And this first 7 miles, just it goes from Builder Supply, takes the old railroad track back behind town, crosses the trestle, the old train trestle, out past Olson Barn, out to Highway 36 and the causeway. It's not 8 miles, it's like 4. But the grant really asks for a sponsor that's going to take it as an exercise zone or areas where people can exercise. So along that pathway, maybe sponsoring through the grant, getting the grant to have things like pull-up bars, chin-up bars, things like that along the path. There's lots of ideas behind this. The grant will not ask us to pay for the equipment, but it will ask us to maintain it. So there may be an ask here later down the path, the road as the grant's being written, that we sponsor it and we also take on some of the responsibility for the first part of the trail. So I just want the board to know that I'm very curious about this. This is the whole person care concept that I'm really philosophically aligned with. And I'd just like to bring it to the board to say that I'm going to be seeking approval to act as a sponsor initially in the grant project.
I think personally, I think it's a great idea. I am glad to hear this is finally getting some traction, because there's been talk about this for years since I've been here, really.
This is a huge thing since COVID. There are grants out there for walking and for outdoor activities that have never been seen before, ever been seen before. I mean, this is a really cool thing. I mean, we're talking about Catfish Beach, trucking in all this sand and actually making it a swimming beach because it's only 11 feet out there, and actually making it a swimming beach where people can ride their bike and sit on the sand. And so there's all kinds of really cool concepts here that we would like to be involved in, but it's getting some attention. Definitely.
Thank you very much for that. All right, any other questions or comments for Sean? Thank you, Sean. So now we will move to tab I. All right, so first we have compliance report. And let's see. Okay, so Chelsea, are you available? Oh, she is. Oh, I missed that. My question had to do with the second paragraph in the compliance report. I don't know if you can speak to that. That says there's continued improvement with the Interpol audit. Care coordination manager reported that as of June 1, the physicians are supposed to be checking medical necessity. I wasn't sure exactly what that meant. As far as medical necessity for procedures or being.
For admissions.
For admissions. All right, and then we also have a report from Anne for the clinic. Anyone have any questions or comments on either of those two so far? All right, we have the report from IT, from TK. Any questions or comments? We're going to get into that a little more later. All right, and then HR from Jim. Questions or comments? All right, thank you all very much for putting those reports together. Okay, so number 15, items to be added to next month's agenda. So I have for access hospital budget. Can you add that?
Let's put up there's an agenda item, and if we have something to enough, we'll update. So, yeah, we'll do that budget.
And then also those two board policies, you know, we get together on, right? On July, so, anything else? Kristen, do you have anything you want to add? Rich, anything you want to add to next month's agenda?
Yeah, I'd like to add a discussion about whether we should have a board retreat this summer.
How about what kind of board retreat? Thank you, Rich. Do you have anything else to add? Okay, well then, with that in mind, we will adjourn to our closed session. Starting you at the time. 3:44. All right, so the closed session is now. At 4:44. And there were no portable actions taken during closed session. Our next regular board meeting is July 29th at 3 p.m. in the conference room and also via Zoom. And with that, meeting is adjourned.